Good day, all. So, today we'll be looking into child health problems, moving ahead in the maternal child health chapter, right? Okay, so giving the intro of this entire topic, every year 11 million children die from preventable causes before they reach the fifth birthday. So, under 5 mortality is too high. That's what it says. And the main key point here is it's a preventable cause of death. So that means we could have prevented the death caused because of these problems in the under 5 age of the kid. Okay, so let's look into what are they, and most common, that is 3/4 of all children visiting healthcare facilities, and 7 out of 10 children childhood death results from just 5 causes. 7 out of 10. Okay, so now looking into what are the main diseases. First is pneumonia, respiratory, then diarrhea, measles, malaria, malnutrition are the main which causes the death. Causes of death in 1 to 4 years age group. So 1 to 4 age group, that's mainly when it comes to death of a child. You can any diseases, there is also prevalence of these diseases most commonly in developing countries and also developed countries. So first, and India being developing country, first let us look into what is happening in our country. So most common cause of death under 5 mortality is diarrhea in India and developing countries, and pneumonia next, malnutrition, infectious diseases and other febrile diseases, accidents are some of them. And in developed countries, we have accident, congenital disease, malnutrition, so malignancies, neoplasms, influenza, and pneumonia. These are all in the developed countries. Okay. So coming to first, that is childhood health problems. Low birth weight. Most of you know about low birth weight, right? So then we have malnutrition, infectious parasitosis, accidents, behavioral problems. So first, let's look into what happens in malnutrition, because that's one of the most common problem in India. So malnutrition could be specific nutritional deficiency, right? Protein energy malnutrition, micronutrient malnutrition, nutritional anemia, nutritional blindness, vitamin A deficiency, iron deficiency. So there are multiple, when it comes to nutrition, all the nutritional deficiency comes into place. So let's look into the etiology of protein energy malnutrition. Okay, so why does it cause? Mainly because of poverty. We don't have power to buy food and get nutritious food. So poverty would be the one. And low birth weight babies, infections, population growth, increase in population, so less demand, increased demand, less supply, all this feeding habits, high pressure advertising of baby foods, so people go for all canned foods, and that becomes one of the biggest problem. Then we have social factors. Again, there are a lot of customs and beliefs in our country that which may lead to believing that the colostrum, the initial milk which is secreted by the mother, may not be good, and lot of things which has to be like, what should not be given, and people don't follow exclusive breastfeeding, and weaning off is not done properly. So all this could be the lot of problems in terms of etiology, why kids under 5 would go for protein energy malnutrition. So there's something called as vicious cycle. I think I had told you in one of the classes. So it's mainly, what is it? It's a cycle which keeps on repeating itself. One action leads to action of another action leads to an action of the next one, and then how the cycle keeps on running. So for example, in terms of infection and malnutrition, that's how it runs, right? So now let me give an example. We have diarrhea. A kid has no infection leading to diarrhea, a lot of fluid loss, and the kid doesn't eat, has someone lethargy, and leading to again malnutrition. The malnutrition also becomes prone for infection, and infection leads to body nutrition decrease, again lead to infection. So that's how it keeps on running. So that is called as vicious cycle. So next, Let's see how the what you can manage and what is the criteria for admission. Of course, when it comes to malnutrition, marasmus and kwashiorkors, right? So if there is the edema is present, dehydration, diarrhea, shock, systemic infections, hypothermia, jaundice, bleeding, age less than 1 year of if the kid is, and or if he has all of these issues, it is highly advisable to admit the kid. Right. So best therapy, the best way to manage this is by dietary therapy, and we have a mnemonic called as BEST. That is, first, beginning of feeding. So anything happens, never stop feeding the child. Okay. So beginning of feeding, energy dense food. So when it comes to food, when a person is diseased, you need to give high nutritious food, dense food, rather than the normal food which you normally eat. Stimulation of emotional, sensorial development keeps on, help the child to go to its milestones of development. Transfer to home-based diet. So a lot of the dietary factors which plays a very big impact on the treatment of the kid in terms of this situation. So second thing is infections of parasite plays a very big problem in the children. So some of our acute diarrheal diseases, as you know, it's most common in India. Acute respiratory infections, second most common. Measles, malaria, HIV/AIDS are rest of them. So first, what is the main problem? In India, the main problem which we're facing in terms of underlying mortality is mainly diarrhea. So you can see diarrhea kills over 1 million children every year through dehydration. So common causes are rotavirus and many other, but mainly is rotavirus. So coming to the next, once patient presents with diarrhea kid and they come to the hospital, how do you, or in the periphery centers, how do you diagnose? Okay, you can diagnose by watery diarrhea or density or persistence diarrhea presence, vomiting, fall in urine output, nausea, food being given to the child, has optimum feeding been maintained. So all these questions has to be asked to do the assessment, and then you do physical examination, signs of dehydration. As you all know, we'll just also be looking into it. Nutrition status of the child, looking for the weight, height, is the growth proper, presence of pneumonia, otitis media, other resistant infections also shows you the complication if it is present. Okay. Next is, as I told you, severity of dehydration. So first you have to know what is severity. Just looking at the condition, well alert, eyes is normal, tears if it is coming because dehydration, mouth and tongue moist if it is present, thirst, drink normally or thirsty, skin, feel the skin pinch, and if it goes normal it's fine. If it takes late time, lethargy, then it is some problem with the dehydration would be there. Feel the skin, so decide if it is dehydration present or not. If it is present, treat dehydration. So other conditions, restless, irritable, sunken, eyes are sunken, tears are absent. So all these things have to look into. So let's see, let's not get into the management part. Mainly we'll look into this. Okay, so main thing is, one of the main thing is you have to give ORS to these kids with dehydration. And mainly dietary management. First is ORS, following the ORS with lot of liquids with ORS, and the next is dietary. Give high density food. Okay, and if it is a kid is breastfeeding, continue the breastfeeding and don't stop the breastfeeding. Okay, so some oil, fats should be increased, so the person should get more proper. And the antibiotics are very highly restrictedly given. If it is given only if the kid has fever, high fever, and only then we go for antibiotic. If not, it's only dietary, ORS and good high density diet are the only two things which has to be given, rarely antibiotics. Okay, remember, we don't normally prescribe antibiotics for diarrheal diseases unless it is severe with high fever. Right, so that is the basic child problem which we have in India and globally, as we know. So next thing is, where are these children more accommodated? Okay, more people live together. The next important place where we need to look into the maternal child health, specifically in child health, is the school health. Unless we can look into the place where group of children live together, it becomes one of the challenging, because that's where infectious diseases could spread from one person to other person. So coming to school health, so what are the problems normally in the school we can address? So like malnutrition, of course, very important. Infectious diseases, intestinal parasites, skin diseases, very important. Eye diseases, ear diseases, dental caries. So these are the most common problems which we could go to a school, and in a day we can find a lot of kids having these problems could be rectified. So that's one of the wonderful thing of it. So next is objectives of school health: promotion of positive health, prevention of the disease, early diagnosis and treatment and follow-up, awakening health consciousness in children, and providing of healthful environment is very important. What is aspects of health school? Health appraisal, improve the health, promote the health, remedial measures and follow-up, whatever can be done at the school, prevention of communicable diseases as much as infectious, healthful school environment so that you keep the environment green and clean, nutritional services, if there is a nutrition deficiency, we'll come back to that, midday meal and all those things will come now, right? So first aid and emergency services has to be trained to the teachers, and also and doctor also to be specifically present, and also look into the mental health of the kids. So also we have very important things, dental caries. So kids favored with the chocolates, and they don't know how to keep the oral hygiene. Dental health, eye health, health education for the kids and also teachers, health education of handicapped children, maintenance and use of school health records also to be done. So what is health appraisal? Mainly you go to schools, periodic student examination done at the time of entry into school, and every 4 years thereafter we have to take the examination of the child by history, clinical examination, look for vision, hearing, speech, nutrition status, parental presence. So all this thing has to be assessed for each child when he joins the school, and also every 4 years, and I have to maintain these records at schools. So this is what normally we do. And school staff examination has to be done, and they should include the examination of teachers and other school personnel when they are present. And now, because doctors cannot be all throughout, now we are looking into teacher-centered approach. So how do you train them so that they can help us to screen and pick up the cases? So we have to what they have to do is daily monitoring, inspection by teachers, suspected pupils for referral if at all, unusual flushing faces, rash, spot, acute cold symptoms, sore throats, neck rigidity. If all these things are present, we have to refer. They have to give us a call, or if the clinic is there, get the clinic. Nausea, vomiting, red watery eye, headache, chills or fever, sleepiness, recurrent to play, diarrhea, skin infections. All this becomes very important to train the teachers to identify, screen at the initial stages of they have to come and show us to the doctors. And what we can do as a remedial measures and follow up, special clinics at PSCs for the school children are done nearby or within the school. Also it has been allocated beds at the hospitals for the required school children also to be allocated. Immunization. So kids are going to schools, and of course it becomes one of the area where you can immunize. Immunization against common communicable diseases is done, and immunization record to be maintained and to be given to the children at the school living. Okay. Healthy full school environment, how to accessible for the location, how the healthy school should be near to your house, high basement sites, adequate area for premises, big ground, all these things, classroom of more than 10 square feet, capacity maximum 40 students per class, combined doors, windows area more than 25 square foot. So all this color, cool lighting and adequate coloring of the building becomes very important. Ventilation, because healthy school environment, right? Okay. So tap distribution, drinking water, urinals for every 15 minutes, one lavatory for every 100 students. The specific things where we can know which infrastructure wise they have to do so that we can keep the healthy school environment. Coming to nutritional services, what school help us in nutritional service? So we have to maintain nutritional deficiency in India school children. Main deficiency is protein, energy, malnutrition. Then are vitamins like C, thiamine, riboflavin, minerals, calcium, and iron. So one of the things which we are doing is midday meal program. It's where it's not a substitute, it's a supplementation of nutritious food for the children along with their home food. Applied nutrition school, you can see there are a lot of gardens, school gardens, like where their crops are raised by the children, and they try to tell them how to harvest and all those things. Specific nutrition like fluoridation of water, if it is present, can be done. Next is teachers first aid and emergency care. Basically telling they have to be trained in all these things. So if it is an accident, if there is a gastroenteritis, diarrhea, give ORS. Some drugs can be given so that they can use it initially. Mental health, if there is any drug addiction, maladjustment, delinquencies, if it is present during the school, they have to take a proper measures, inform their parents, and also counseling has to be done for these people, right? So next is dental hygiene. So dental care is periodontal diseases, dental hygiene, dental health education, and maladjusted teeth. These all could be looked into when it comes to dental screening for school health children's. So eye diseases, basic eye health services should be provided. Basically, early detection of refractive errors. When you see a child is sitting in the last bench and not able to see properly, you make him to first sit in the first bench and still not able to see properly, then of course there's some issues which we have to, and teachers are the best people to find these eye disease problems, refractive errors. Okay, and also vitamin A also should be make sure that they take so that they don't get into the vision issues. And mainly looking into personal hygiene. As you know, the corona current situation has made everyone more hygienic, more health, preventive measures are looking into. So personal hygiene, posture, habits, environmental health activities, participation in environmental health programs, family life education including reproductive health, children at home health education. With corona, you can look into everyone is having online education and training, right? But however, the emphasis on preventive health is mainly important in terms of personal hygiene, and all the health education has to be given to these kids so they are equipped to prevent any further diseases which can happen, right? Thank you. So hopefully, I know it becomes a bit difficult to interact in this type of platforms, and because of the constraints which we have currently, I think this is one mode which we have to get adjusted for the meanwhile. But however, once the entire things reopens, hopefully we could go back to our own whiteboard teaching. So have a great day. Thank you. Bye.